When you hear of a doctor opening up, it's like a horse race. It's whoever gets there first.
And I kept phoning and phoning and phoning, and no one takes new patients.
More and more Canadians are desperately searching for what we used to take for granted, a family doctor, the gatekeeper to our complex medical system.
It's 4.5 to 5 million Canadians don't have a family physician.
And it's getting worse. Across this country and wherever you live, small town or big city.
I'm just wondering if there are any physicians at the clinic who are taking new patients.
Sorry, there's not.
In Digby, Nova Scotia, 60% of the population is without a family doctor. So are 250,000 people in booming Calgary.
Why aren't there enough family practitioners? Because we decided they were the least important thing.
It's coming apart at the seams, and in fact, there are too many seams.
In Ontario, 1 million people are without the continuity of care vital to the health of the nation.
I don't think it's a single crisis. I think it's a multiple crisis.
To be honest, I don't think we've seen the worst of our problems yet.
You're next door to death before you finally get to see a doctor.
Beth Webb has been searching for a family doctor since she moved to Chatham-Kent, Ontario 2 years ago.
Yes, I was wondering if you were taking new patients. When I first moved here, I phoned the hospital expecting a list of doctors. There was no list of doctors.
Beth isn't just after routine care. 3 years ago, she was diagnosed with breast cancer. She's in remission, but recently found a lump on her ribcage.
I found this lump and panicked and thought, I don't have a family doctor. I looked it up on the internet, and I was surprised to see that it could be a reoccurrence of cancer. I decided to go to emergency, and I actually sat there for 7 hours waiting for a requisition form for an ultrasound. I went the next day and had the ultrasound. Then I had to go back down to emergency and wait for the results of that ultrasound.
Another 4.5 hours waiting. Emergency rooms across the country are drowning in people like Beth, people without family doctors.
But it's a very inefficient way to use an emergency room. So having a whole bunch of people end up there because they have no place to go for primary care is just bad organization of the healthcare system.
I haven't had a pap smear now for over a year because I don't have a family physician to have one. And as a cancer patient, I mean, that's really important. You don't want to sit there and you feel like a criminal because you're taking up someone else's place in the lineup. Like, my baby's sick. What are you doing here? You don't look sick. I'm sorry.
Family doctor shortages used to be a small town problem. The majority of us who live in big cities believed we were somehow immune. Not anymore.
When I moved to Alberta, I didn't expect at all to have a hard time finding a doctor. There's so many people, I figured there must be so many doctors here.
But no matter how many phone calls she made, Tara Percival could not find a family doctor. A constant worry because her son Aidan was born with a malformed skull.
I do worry about him because his head it changes all the time. All right, are you ready? What if his brain moves? Like, I don't know. I know.
Tara wants a doctor who knows her family, who can answer her questions and help calm her anxiety. Through a walk-in clinic, she was able to get Aidan a referral to a cranial specialist, but it will be 6 or 7 months before the appointment. In the meantime, Tara's only regular medical advice comes from the internet, Dr. Google. What she's learning is that the earlier the treatment, the better the results. For Aidan, the clock is ticking.
Is there something we need to look out for? Is there something I should be doing? If I had a family doctor, I would have somewhere to go.
Sharon Scrimshaw's daughter Susan had what's supposed to be a manageable chronic condition, asthma.
She suffered in the winter, she suffered in the summer, pretty well all the time. It was ongoing.
With a family doctor to regularly monitor her condition and adjust her medication, Susan was able to live quite a normal life. But when her doctor retired, she couldn't find a new one. For 5 years, she tried to manage her asthma with trips to walk-in clinics. But walk-in clinics couldn't provide the continuity of care Susan so desperately needed.
Well, the doctors at the walk-in clinic are always different. They didn't know her as a person and the severity of her disease. So lots of times they would just give her medication that they would probably give somebody that had mild asthma.
At a friend's house one evening, she felt an asthma attack coming on.
So she took a walk outside to get some fresh air. And when she came back in, her friend told me that she could tell she was in stress. And as she passed out, she was falling, she just kept saying over 911, 911. So by the time the paramedics did get there, her heart had already stopped from lack of oxygen.
32-year-old Susan Scrimshaw died on Valentine's Day, 2006. Died of asthma.
I think if Susan had had a family doctor, I would still have my daughter.
This was not supposed to happen here in Canada, the home of Medicare.
These are monuments of which we can be proud in a Medicare program, in adequate health services for every man, woman, and child, irrespective of their income, their age, or their physical condition.
For many Canadians, Medicare has become much more than a social program. It defines us as a country.
And Medicare is an expression of the public good in Canada, of egalitarianism, of a middle-class society, of fairness, of inclusion. That's what Medicare is all about.
Hello, guys. How are you?
There's international research showing that countries with strong primary care have healthier populations, fewer hospitalizations, lower medical costs, and fewer premature deaths.
And you're going to put on a dance for us, are you? Okay, guys.
From an overall impact on health outcomes for the whole population, probably the way that the family doctor interacts with their patients has more to do with it than all of the high-tech things that we hear about.
Try to stay still, Tiger.
Family doctors are the heart of Canada's medical system. They're generally the first person we see when we get sick, referring us on to specialists when necessary. Yet today, 5 million Canadians are without that continuity of care that we took for granted just a generation ago.
So Medicare is starting to crack.
And this old guy, I know him for how long?
Dr. Al Trinka began his career as a family doctor in the heyday of family medicine 36 years ago.
The best of times were the 70s, the early 70s. I had an office practice, and in the early days we were on call. So if I was working emerge, I was treating heart failure, I was delivering babies.
These were the best of times for patients, too. We were actually encouraged to shop around until we found a doctor who was the perfect fit. But when the economy crashed, it landed on Canada's medical system.
The economy was terrible in the early 90s. Ontario lost 750,000 factory jobs in under 2 years. So you had revenues collapsing, big deficits.
The bureaucracies in provincial government started to say, boy, this healthcare is really consuming a lot of our resources. So the bureaucracy got the concept that every physician in the system was really a cost center. And the idea was that, well, the family doctor ordered a lot of tests, sent people to hospital.